Situations in which hair transplantation cannot be performed are very limited. Hair transplantation cannot be performed in patients with congenital shaft anomalies. This represents 3% of the patient group. In addition, in patients with systemic disease such as anemia and hypothyroidism, the disease is treated first, and then hair transplantation is performed. 95% of patients are eligible for a hair transplant. It was thought that hair transplantation could not be performed in Norwood 7 patients who previously had severe hair loss. However, with the use of body hair and beard as hair transplantation grafts, patients in this group also had the chance to have hair transplantation done in 1 or 2 sessions. Hair transplantation process starts with the hair transplant examination. Before the hair transplant examination, a detailed history is taken. In the anamnesis, the genetic roots of the patient's hair loss, the other diseases accompanying his condition, drug allergies, and conditions that will prevent or complicate hair transplantation are examined. Then, the harvest area is examined with the help of a biomicroscope or dermatoscope. Here, information such as the grafts being 1, 2 or 3 and the thickness of hair strands gives the doctor an idea about who the hair is for. The hair transplantation area is measured, and after the transplantation area is measured, the average number of roots needed per 1 cm is planned. At the end of this, number of roots needed is obtained by multiplying the planting area with the number of roots per square centimeter. If the required number of roots is available in the harvest area, the patient is directed to pre-transplant examinations. In the pre-transplant examinations, bleeding, coagulation time, infection checks such as hepatitis, HCV, HIV, hemoglobin A1 and C, and thyroid tests are performed. In addition, ACG is taken to the patient. How to do the hair transplantation? Hair transplantation is actually a 3-step process. First, the process starts with the opening of channels in the area where the transplant will be done. There are various surgical instruments for opening the channels. The channels are opened in accordance with the natural hair directions with a 0.1 mm slit made above the hair follicles. The channels opened are counted during the opening process, resulting in this net number of roots and number of grafts being calculated. Later, during stage 2, the bag is anesthetized and harvested. The harvest area is drawn and local anesthesia is applied. Afterwards, the harvesting process is done with 0.1 mm punches made above the hair follicles. Roots taken simultaneously with the harvesting process are separated into 1, 2 and 3 grafts, washed with a special solution and placed in the refrigerator in the solution. Later, these roots are placed one by one in the open channels. This part is performed by 3 different expert technicians.